This shows, and we've picked 5 areas here to take a quick look at. These are examples of charts that you're going to find throughout the entire report. Okay, and so if we look at the very first one, it's immunization. I hope you can read this over the web. It's immunization, and the measure is, or the objective is fully immunized young children 19 to 35 months. The 71.4% says that 71.4%, okay, of the target that had been set, of the distance between where we were in 2000 and the target, actually had been met. Okay? So we're not there. If we drop down, and then I'll give you more on this in a second, but if we drop down to the dark blue line, that's access to health care, and it's one aspect of it, and it's the decrease in, what we're seeking here is a decrease in hospitalizations for pediatric asthma, feeling that, in fact, those hospitalizations can be decreased if there's appropriate care ahead of time. And here, 142% of the difference between where we were in 2000 and where we wound up in the year 2010 had actually been achieved. So it's a tremendous difference. If we can go to the next slide, this provides the detail on the next slide that you need to really understand these figures. Well, we seem to have actually missed something here, but I'll go on to this one and I'll show you here with physical activity, or actually with overweight and obesity. The table part on the right, okay, gives the figures for the target, okay, for the baseline of the measure, for where we wound up, okay, and then questions of the difference, the percent change, and whether or not the differences were statistically significant. Okay? And so for obesity in adults, we see the arrow on the left going, if you will, in the wrong direction. Okay? And the target was to be 15%. And starting out in 88 to 94 here as the baseline, we were at 23% of adults were obese. Okay, adults being people 20 years or more of age. We wound up here at the end of this period with data coming from the NHANES program at 34%. So instead of going down, we actually went up by about almost 50%. Actually, it says in the far right on that slide, 47.8%. Okay. So we have a chart like this for every one of the 733 objectives in which that we could evaluate, which really summarizes where we were, where we are, did we make progress, and in effect, I guess that's the bottom line. Now, there's other data as well in here. If we could go to the next slide, let's turn to a couple of the reasons, I guess one could say, that the longevity has increased. And that longevity has increased because the leading causes of death have actually decreased. And the first one we're looking at is overall cancer mortality. Which, pardon me? No, I know, yeah. Oh, I'm giving stage directions. But in any case, what we've got here is a considerable decrease in this, which I think is about 11%, if I recall correctly, in overall cancer mortality. This is a decrease, again, that's more than 1% per year, which from a public health point of view, statistical significance point of view, there's no question that it's significant and extremely important. At the same time, we didn't meet the target. The dotted line is the target, and we lie above that line. Going to the next slide, okay, we can see that in fact the rates by race are quite different. Okay, the overall rate, because of the prominence of the numbers of the white population, is very similar to the overall total rate. Other rates for other races are below this, and in effect are doing better than the target, and started out doing better than the target. The thing I want to draw your attention to, though, is the difference between the white and the black rate. The difference that there was in 1999, in effect, has persisted over the decade. Okay, although there's been some, the decrease among the black population has actually been greater and faster than the decrease among the white population. So what we see here is progress, but we see persistent disparities. Okay. If we look at the next slide, this is an example of charts that we have throughout the report showing the geographic difference. Going to the next slide, many of the objectives have to do with interventions. Okay? This shows interventions related to for colorectal cancer screening. It shows the screening, and here we see considerable progress. In fact, doing better than the target in terms of the rate of screening, and fecal occult blood test heading down, which in fact was the recommendation. So we actually have done well in terms of that. Going to the next slide, we're turned to coronary heart disease. Okay, and if we look, and we can see the parallel lines here, the persistence of the differences by race, and if we look at the endpoint on the next slide, which I thought would circle the endpoint, but you can look just as well. At 2007, we can see that the black rate persists as considerably higher than the white rate, okay, with the Asian rate much, much lower. In effect, that's the best rate.